Hello, welcome to the CIRS Healing Collective expert guest video series. I'm Jenny Johnson, the host and facilitator of the CIRS Healing Collective, which has been a resource for aspiring CIRS overcomers to share and connect from around the world since 2020. I'm a shoemaker proficiency partner and CIRS coach, and most importantly, an overcomer myself. What you're about to see is a 10-minute excerpt from a 90-minute group discussion that members of the CIRS Healing Collective got to have live with this expert guest. If you would like to see the full 90-minute replay, come on over to the CIRS Healing Collective. We have a robust video library from the past 5 or 6 years of so many expert guests. Better yet, you'll be able to join our future monthly live discussions with experts to come. We'd love to have you. Thank you and welcome to Amber. I'm so glad that you're here. Thank you for being with us.
Thank you very much. It is truly an honor to be here. And there's something really powerful about being in a room, whether it's on Zoom or not, with people who have lived through CIRS. I think it is what you're doing, Jenny, is incredible. So thank you for this opportunity to join your group.
Absolutely. Yeah.
I wanted to make this interactive, and I will preface this with, I'm actually in a hotel right now. Hopefully I don't lose my Wi-Fi because I unfortunately was exposed to mold last night. And so anyways, you guys know how that goes. It's, it's lovely. So I'm a little foggy today, but we'll roll with it. Hopefully we'll be good. But I want to
We understand. You have an understanding crew here.
Yeah, I want to make this interactive. And, you know, we'll definitely leave some time for a conversation and questions at the end, like we talked about, Jenny. But I guess I'm just kind of curious getting to know you guys for a quick minute or two at the beginning. What are some questions I can ask? Are any of you familiar with Mast Cell Activation Syndrome? Maybe you've been diagnosed with it, or you've just heard of it. What about POTS or dysautonomia? You don't have to, raise your hand if you're not comfortable. And then of course, EDS. Have you guys heard that term? Ehlers-Danlos. Have you guys it's on the radar? Yeah, so that's kind of the trifecta, like Jenny said, that we'll get into a little bit tonight. But the other curiosity I have is, has anybody heard of the Polyvagal Theory?
Yes.
Okay, see a couple hands for that, a couple nods. Okay, what about the Safe and Sound Protocol? Has anybody heard of that? The SSP? No, so that'll be kind of newer information. I better check the chat to make sure I'm not missing anything. Okay, great. Wonderful. So that'll kind of help me know what to focus on tonight. I was telling Jenny I can ramble, so I will try to be mindful and not do that. But feel free to interrupt. I don't mind if you have a question as we're going along. If something's unclear, please let me know. I'm not great at checking the chat when I'm sharing a PowerPoint. So if you want to unmute yourself and say something, that's totally fine with me. I don't know what your typical etiquette is on here, but I don't mind. Or you can wait till the end if you have a question you want to save. But again, thank you for letting me be here. So it looks like I can share my screen here.
Yeah, you should be able to.
Okay, so tonight, this is kind of the area I think we're going to focus on is the polyvagal theory. So we'll start out by sharing what I know about the polyvagal theory. We'll touch on trauma a little bit in the nervous system. I don't think I need to give you guys any trigger warnings here, though. I think that this conversation should be pretty low key in terms of that area. And then the trifecta biotoxins in the nervous system will touch on a little bit of kind of how those different conditions overlap and relate. And then Jenny also had mentioned that some of you are interested in learning about nervous system programs that are out there. The Safe and Sound Protocol is one that I use in practice, and I believe Jenny offers it as well to clients, but there's a lot of different options out there, so we can brainstorm some of those. Now, we want to remember this can happen at any given day. You can experience all three of these states. So this isn't something that you pick one and you're in it all the time. The nervous system is constantly sort of in flux here based on what's going on around us. And so, and our thoughts. So we can certainly be in different zones at different times. And some people use analogies when they talk about these different states of the nervous system. They'll say, oh, that green zone, the ventral vagal, the top of that ladder here, that's like sunny, everything's sunny if we're doing a weather analogy. The sympathetic zone might be stormy, so that's the fight or flight. And then the freeze, which is that blue, that dorsal vagal pathway, that might be foggy if we're using a weather analogy. So you can kind of think about your own body, and I encourage my clients to do this and to kind of determine what does each of these states look like for you, because a lot of times people kind of are stuck in this dorsal vagal without realizing it. We start to get into the nervous system, specifically looking at some of these different cranial nerves. We're going to talk about the SSP. So I kind of focused on some of the things that we hear. When we're infants, naturally, we're more in tune with the high frequencies of sound. So that would be something like the sound of a parent's voice that might be soothing us when we're infants. However, once we've experienced trauma, whether it's big or small trauma, typically the nervous system becomes more hypervigilant, and our ears strain to hear these background noises, and the background noises are at a lower frequency of sound. And so over time, our system can adapt to have a very heightened awareness of background noises, lower frequency sounds, and that can make it harder for us to comprehend human speech and the higher frequency tones that are around us. This can show up clinically, as things like difficulty focusing when there's background noise, or sensitivity to noise, easily being startled by noises. There's a lot of different ways that this can manifest. And I know a lot of the individuals that I work with, they have a questionnaire they fill out with a lot of these types of questions. They can identify with those types of symptoms. You might feel that way yourself. I'm actually going to share the questionnaire I use in case you guys want to take it. But anyways, basically, we have these cranial nerves that subtly shift after trauma. And again, it could be the comment that kid said to you in 4th grade the wrong way. Trauma looks differently. It doesn't necessarily have to be something you recognize as being traumatic, but over time, our nervous system shifts. And we also see shifts in things like how sensitive our skin is to touch and fabrics. We see shifts in our visual sensitivities, especially to bright lights, and also a shift in our, we know biotoxins impact the pathways, such as the optic nerve pathways that influence our ability to have good night vision or to detect contrast, things like that. So there's a lot of overlap with these different cranial nerves and trauma and how it influences them. But basically, we don't want these adaptations to happen on a continual basis. And so once somebody's in chronic illness, they can kind of feel stuck with some of these symptoms. And so the whole goal of some of the nervous system work is to help sort of, I don't want to say retrain, but sort of re-educate or reshift the system from a conscious level of awareness, but also on a subconscious level, which we'll talk about with the SSP. So the trifecta, we have these different conditions here on this visual. And so how is this all connected? So I just brainstormed some of the many ways that these conditions might be connected to biotoxins from mold and other sources. There are a lot more connections than I could fit onto one slide. So I'm sure you guys probably can come up with some other ones, but this even sound protocol, I'm just going to start calling this the SSP. But there is a website called Integrated Listening that tells a lot more than I'm going to share in this presentation today about this therapeutic approach. Basically, there's a ton of research behind it, a lot of peer-reviewed studies. The original research focused more on children and it focused more on autism, but since then it's expanded tremendously, and we have an abundance of literature talking about kind of how it works and why it works. But basically, the SSP is a music-based therapy where you use a headset and you have different frequencies and tones that are embedded into the music that you're listening to. Now, you can't really hear it. It just sounds like normal music to me anyways. I don't know, Jenny, if you've done it yourself.
I'm only like a third of the way through the training, Amber, and I'm loving it so far, but haven't actually started listening to it yet.
Okay, well then I'll be curious once you've done some listening, what you think. But for most people, they don't to the ear, it doesn't sound different than just turning on the radio, for example. So it sounds like normal music to most people, but it does have these tones and frequencies embedded in there. And the reason it has these special frequencies in there comes back to that concept of low frequency versus high frequency that I talked about with when we're born, we're tuning into our parents' voice versus trauma makes us more in tune with the lower frequencies. So basically, we're getting the other frequencies to these muscles, which actually works to kind of strengthen these muscles, these tiny muscles called the stapedius and the tensor tympani, in case you were curious, little tiny muscles inside the middle ear. But basically, it impacts those muscles so that our nervous system kind of gets a reset button, and we're able to then be more in tune with the higher frequencies of human speech, and we're less hypervigilant and less tuned into that background noise, for example. There are neighboring cranial nerves that run alongside some of those that are influenced by this program. And so we typically see improvements not just in auditory areas, but also in things like digestion and sensitivities on the skin, like tactile sensitivities. Even neck tension was one of the cranial nerves innervates the upper trapezius muscle right here. So we see a lot of different, connections as you start to do the listening. A lot of aha moments for people, which is kind of cool in terms of the other systems and areas that are impacted positively by this approach. Now, what I love about the SSP is that it is not a conscious focus on trauma. So we're not diving into any of that, although I think that work is important in other arenas. It's certainly outside of my scope. And so with this piece, it's really working on sort of more of a subconscious level of helping heal the nervous system. It is a springboard for growth, but I do not feel it's a standalone tool. And so this is important. If you're interested in pursuing this, you want to find a practitioner who is going to teach you some exercises and some things to do with it, and is going to integrate it into a broader plan of care if you can. I think that's really important. It's really important to be aware of your nervous system and where you're at before you start the listening. Some people just, get access to the music and they just want to go and kind of plow through it and check it off the list. But we see better results when people kind of go slow, kind of microdose the listening. Maybe it takes 4 to 6 weeks to do. We used to do the 5 hours of music in a week, like really quickly. In fact, before the pandemic, a lot of practitioners were having people listen to 1 hour of music 5 days in a row, and that was it, and they were done. And I actually did start that way a little bit with people, but I found that the doing anywhere from 5 to 20 minutes a day and kind of spreading it out seemed to be more effective in my clinical experience.